I'll start from the top and welcome you back here for our Health Cog Extra, the National Health Service, as we look at what's next for the NHS. I'm Tabitha Goldstorp, the co-founder of CogX, and I'm thrilled to be welcoming you wherever you are today. Don't forget, not only can you listen to our amazing speakers, but you can check out the expo and drop a line to some of the brilliant organizations showing their innovations there. Now, we are going to introduce the fantastic Indra Joshi and Simon from, I don't have the Simons, both from the NHS, and Tina Woods, the CEO and co-founder of Collider Health, will be interviewing the two of those experts who will look into the NHS AI Lab and give us a insight into what's next for them. So, Indra, please do take it away. Tina, take it away.
Hi, thank you so much, Tabitha.
Morning. Sorry, Tina.
It's one of those mornings, isn't it? But we're ready for everything. COVID has taught us that. So thanks, Tabitha, and really, really pleased to be chairing this session in conversation with Indra Joshi and Simon Madden, who I know very well. The title of the session is called Heads Up, Get Ready for the AI Healthcare Revolution. So we are going to, now the NHS AI Lab was introduced about a year ago to accelerate the safe adoption of AI in health and care. So what we're going to do is I'm going to invite NHSX's Director of AI, Indra Joshi, and Simon Madden, Director of Policy and Strategy, to tell us what they've been doing and what their latest thinking and plans for the future to make this a reality. We're going to cover the role of data and enabling AI and how we can deploy the right policies around data and information governance and how to get it right moving ahead. So I'm going to ask Indra and Simon to come on to the screen. Sorry, my headphones are coming off. So there's Indra and there's Simon. So I'm going to ask each of you to sort of just give us a little bit of a précis for some of the stuff that you're looking at now and sort of ahead, answering this question, I guess, sort of what's coming and how are we going to get AI right to deliver better outcomes in health and care. So I'll start with Indra first. So Indra, take it away and just tell us what you've been up to.
Brilliant. Thanks, Tina, and thanks, Tabitha, and welcome, everybody. I hope you enjoy our session today. So just a really brief overview, and then I'll hand over to Simon to talk a little bit more about the wider strategy that we're doing here in the NHS around data. Last year, we announced the launch of the NHS AI Lab, and over the last year, including during COVID, we've been doing a tremendous amount of work to build those programs out and to ensure that we can not only build the rules of the game, so work with all of our regulators in understanding how do we make it a bit more of a joined up system, how do we ensure that once a product is into the system that we've got a good way of what we call post-market surveillance, so ensuring that it remains safe and validated throughout that process. But also, how do we, as you've mentioned, accelerate the adoption within the system? So some of you may have heard that earlier this month, we announced the successful bidders for our first round of the AI award, and we're due to launch the next round later in the year. So do look out for that. So this is about not just building the technology, but also putting it into the system. And as often we talk about, it's not really just about the technology, but building that ecosystem around it. So what we've been doing over the past few months and hope to do, to answer your question, Tina, like what are we looking forward to over the next few months, is to build that ecosystem out. So we know we've got some good technologies and we know we need to get forward to build that community. So what we're doing is launching a community of practice. Now, in true virtual home working style, I've just got a delivery at my door. So Tina, can I hand back to you for literally 2 minutes?
Absolutely.
I'm so sorry. And I have to go and get the door.
I love it. I love living this sort of new normal sort of existence. So while Indra is attending to her parcel, why don't I ask Simon to give us an overview of, set the wider scene, because really, Simon, that is very much in your gift. It's the wider context for what Indra has just mentioned, the community of practice. So give us a little bit of a feeling what the wider context is And actually, and a thing to ask you about as well is, the announcement yesterday on skills and training, because that's going to be a big issue ahead. So, and potentially will be one of the things that Indra picks up with the community of practice. Indra's back, but I was just going to ask Simon to sort of pop in and set the wider context for the community of practice, the virtual AI hub that you had just mentioned. Is that okay, Indra?
Absolutely.
And then I'll come back to you. Oh, that's okay. At least you got your package.
Indra may well be better placed to talk about the AI hub, to be honest.
Sure.
But I don't want to steal her thunder or even.
We'll come back to the hub. Yeah.
Yeah. So obviously, data has played a key part in our overall response to COVID. And whether that be through invoking special regulations to allow us to share data more effectively during the crisis, or providing for enhanced summary care records so that the wider health system can access data more readily, or promoting research and access to data for planning purposes, or indeed helping through the AI Lab to create something like the National COVID Chest Imaging Database, which is a real achievement. I think that what we've seen is that through that COVID work, there's a great deal that we've been able to achieve, and we just need to bottle some of that achievement and take it forward now into our sort of wider mainstream activity. The downside, if you like, of the work during COVID has been that we've had to do it at great speed. And that's often meant that we haven't been able to engage with partners and others as we would have liked, simply because of the pace required from the response. So I think moving forward, we are really now wanting to ensure that the sector is increasingly able to harness data safely, securely, ethically, and effectively for the benefit of patients and the system as a whole, which will also provide that wider enabling environment for AI and its further growth. So we're developing a strategy now for health and social care data, which we hope to publish in the next couple of months. And that will focus on how we better empower staff and system leaders to be confident to handle data through simplified information governance, which has proven extremely successful throughout the COVID-19 response. One of the really early things we did was simplify the guidance and really target frontline professionals rather than information governance experts in giving them the confidence to use and share data in often new and innovative ways of working. We want to continue to build public trust and be transparent in our use of data. We want to make sure that we have the framework and the rules in place to be able to share data to join up care. Greater links between health and social care. We want to make sure that we can use data to enhance our ability to plan and commission services, improve the quality of treatment, and also improve the quality of research. And obviously, from an AI perspective, to adopt a safe, effective, and ethical data-driven technologies approach, such as AI, where health outcomes can be dramatically improved as a result. So that's just a little flavour, I hope, of the work that we're doing at the moment, which we're engaging with stakeholders on and hope to be able to publish around the end of November.
That's fantastic. Well, that's really interesting, Simon. I've got a whole bunch of questions, and I'm sure we'll get some through on the chat line. But actually, you set the scene, the broader context, and actually what I'd really like Indra to do now is to tell us in reality, in practice, rolling up our sleeves, how is this community of practice, this virtual AI hub, going to make all the things that Simon talked about a reality on the ground? And what do we want to see coming out of this in the next 6 to 12 months, and looking ahead even 3 years? What do we want to see come out of the community of practice?
Absolutely. Thanks, Tina. And I think what Simon has said is really about laying the groundworks and creating that ecosystem. And what we hope with the community of practice that we've launched, and we've launched it on something called NHS Futures, which is a much wider community incorporating a multitude of users both across the NHS but also the wider health and care system, is to say, how do we, quite a lot of this is about hearts and minds. The technology can do great things, but quite often it's about putting the technology into a host system, making sure that you've got the infrastructure right, but also that you have the buy-in both from clinicians, the operational teams, and the tech teams as well, and bringing them all together. And so by actually creating a virtual community, obviously during these times we've had to think slightly differently about what we wanted the real AI lab as a kind of a physical unit to be. So we've now launched a virtual AI lab on the Ethernet, so to say. And that's where we want people to come together to share ideas, to share problems, to understand what's actually happening. Because quite often you can be, and having been a clinician on the front line, you can be quite head down in the problems of the day to day. And actually understanding that, yes, there are other people out there who are they have exactly the same issues. Maybe, as Simon alluded, it might be an IG clarification, or it might be around how do you actually implement that particular stack here. So there are various problems that we know people face, and they've come to us and explained those to us. So we wanted to build a community where people could share amongst themselves. There's a lot of experts around, and we wanted to bring those experts more into the limelight and say, look, if you've done something brilliant, be it up in the Northeast or the Southwest, come and share those ideas and share with others how you made it work. So whilst we can do quite often the top policy level, this is also about creating that, what we call people-powered change, and making sure that from the bottom up as well, we can enable, as we say, the acceleration of the safe adoption of AI into health and care.
Fantastic, Indra. So just a question, just for those who are listening. I mean, who do you want to sign up to this community? And hopefully we can send the details about signing up. It's on the Future NHS collaboration platform. Who would you like to join this community?
I mean, this is an open community. We've always got an open door. So anybody who's got an interest in this space, number one, and is passionate about change. You have to be passionate. If you don't have the passion, quite often, the change doesn't always happen. We want experts. If you've completed a project or you're doing a project and you know how to make that change, be it in an operational system, a clinical system, we want to hear from you. And also, if you're building a program or building a project or a device or a product, we also want to hear from you as well. And we also want to hear from those people on the front line. And a key thing is what are your problems? I mean, when we talk about AI and data, it's really key to narrow down what's the problem that you're trying to solve. Like, what's your question? Quite often we find that people come in it from a slightly different angle. They kind of see what data they have, and then they try and find something from the data. But actually, if you reverse that and you say, well, actually, I have this problem. Does the data exist? And if it does, let me try and do something with it. And then that quite often helps win in, as I talked about, winning in that community and that change from the ground as well.
So sorry.
No. I could carry on talking, but I'll pause.
So just a couple more questions just on the practicalities, and I'll come in to Simon in a second. So I know a couple of the areas that are the initial focus of the community of practice are place for example, all the award winners of the recent AI in Health and Care Award can share their stuff, to talk about their journey, etc. There's also this fantastic place, the National COVID-19 Chest Imaging Database, the GitHub there, and that there's an element around that, just getting your hands on the right data to do the right stuff. You can only do great AI when you've got great data. Is that, just tell us a little bit more around, how the imaging program is almost like the sort of the trial case, the test case for how we can do this in other applications.
Yeah, so we've called it the NCCID, a National Chest COVID Imaging Database, and this was really built out, and Simon alluded to it earlier, during the very, I called it the depth of the pandemic. But we had a lot of companies who came to us and they said, we've got some great models, you should use them. And then we had a lot of people who came to us, mostly from the clinical community, who said, this is quite a novel disease. We don't know that much from the pathology of this condition and how it affects, so we all know it's a respiratory condition, but how it affects the respiratory system. And so we talked to a lot of the community and we said, well, what will be helpful in this space? And they said, well, look, if we could understand all the images, so we're not just talking about X-rays, we're talking about chest images from a CT, so computed tomography, MRIs, and X-rays. And we said, well, what can we learn when we pull all of these together, what that pathology is? And quite often, very related to this, but also from a very technical perspective, what we wanted to find out and what we'd heard from the community as well was, well, we know that products work, but do we know that they work for us here in the UK? So how do you validate an algorithm in this particular context? So as we've mentioned, AI has a huge spectrum. We wanted to narrow it down and say, okay, let's focus particularly on the chest imaging side to say, well, how can we validate models coming through in that particular aspect? And what we've seen over the last few months and moving forward is there's a huge interest in this, because from a data perspective, images are well coded. They quite often have quite a number of good labels on them. Obviously, there's a huge amount of clinical input in that as well to make sure that there's a standardization around that. And we're working very closely with our standards team. We have a director of standards here at NHSX and the wider community to say, well, how do we standardize some of these reportings as well to help us actually, as you say, build a large enough data set to then validate models, but also to train models on as well. So if people are interested, please do get in touch. There's lots of details on the NHSX website.
Fantastic. And so Indra, that was really helpful. And of course, in many ways, it made complete sense. Obviously, just the sheer urgency with COVID and the use case that came out of the COVID experience with what you're setting up on the imaging side. But just a question, maybe Simon, you could step in here. Especially coming out of COVID, we've seen really the urgent need for how NHS and social care needs to come together. They need to be seen as equal partners. And of course, there's a lot of talk about that, and presumably will be part of your data strategy. How can we, and maybe the community of practice will be a place to do this, but how can we make that work? Because it's a much messier affair, isn't it? With data, access to data, standards, what's your sort of plan around that? And how can we facilitate that and deal with things like digital maturity in organizations in the care space? I mean, these are absolutely massive, gigantic problems.
Well, you're absolutely right. And of course, one of the benefits, I mean, it may seem a bit of a processy thing to say, but one of the benefits of NHSX being composed of both the Department of Health and Social Care and NHS E&I is that you can bring those two parts of the system together to sort of co-create solutions and work on policy issues together with a degree of confidence that they're going to be able to be delivered on the ground. And so from a policy perspective in my space, we're working very closely with the department on its wider vision for social care reform. And the important thing is that tech cannot be an adjunct to that reform. It has to be absolutely integrated into that whole process. But you are dealing with two. I mean, you're not actually dealing with the social care sector. It's there are multiple sectors, multiple organs or approaches within the overall social care system, they are obviously at very different levels of maturity. So what works in dealing with the NHS as a more sort of unified and mature system won't necessarily work with social care. So that is one of the key challenges that we have. How do we make sure that we're helping and incentivizing smaller providers, those that have less capability? How do we make sure that we can perhaps invest in some of the skills and the capabilities that are needed? I mean, there's 0 point in trying to get tech into social care to help increase data flows and improve the quality of data, which then obviously improves the quality of care as well. There's very little point in doing that if you don't have a workforce that has the right digital skills to be able to do it, and also that the leaders of the system have the right digital skills and capabilities and awareness. So some of these things will be dealt with through the data strategy, but I would say as well that we're also in the midst of a spending review, where obviously this is a key part of the planning and the sort of processes that we're going through to think about what are the next steps.
Fantastic. So I've got a couple of questions coming from the chat line, but I'm going to ask one question first, which kind of sets the scene for this. So we have our national data strategy out for consultation. We've got the health and social care strategy in the mix. How, and I don't know, because of course, these are vast and gigantic sort of challenges, that we need to look at as a nation, to really deliver on improved health, resilience, and indeed economic resilience of the nation. But how far are you going outside the system in terms of understanding people's lives, the wider determinants of health? Is that something on your radar? Or are you sort of deciding to kind of focus, initially on system first and then go out? What's your sort of policy on that, your approach to that?
Well, I think that it is to some extent system focused, because that's what helps drive the right outcomes that we want to achieve. But that's not to say that we're all sitting at our desks just trying to work out what we're going to say. We are certainly in developing the health and social care data strategy. We are doing some public engagement. We want to establish citizen panels, not just for the formulation of the strategy, but on an ongoing basis, so that the strategy will be a mixture of narrative, setting the direction, but also include delivery plans, which will help us chart the way, if you like. And the purpose of the public engagement, an ongoing public engagement, will be to keep testing whether the public is with us on those plans, because there's very little point in doing that. If we don't have public trust, if we're not transparent, then we are not going to be able to drive and achieve the outcomes that we want within the system.
Absolutely, and public trust is absolutely fundamental at the heart of this, isn't it? So I've got a couple of questions, and I'm going to ask one for Indra and one for Simon. So going in order, and there's a question here: what role does Payne corporation tax have in providing finance for the development of AI systems in the NHS, and what role does Microsoft have in this? Who would like to have a go at that question?
If we just take it from a broader perspective here, we've partnered across the system, so it's not just us, but across the NHS, you see a lot of partnerships, and both industry and the healthcare sector, when they join up, some quite fantastic things can come about. And we've seen this in the AI award, where we've had a number of industry partners come in to do some quite innovative ideas, but also to help the system progress. So I say, we all learn from each other, and this is about different skill sets. Sometimes they may come in with more technical skill sets. We may come in with more health specific skill sets. So it is about bringing those skill sets together. And our role is to make sure that we learn from each other and that we can actually deploy what's right for the front line and the clinical staff, but also the system as a whole.
Okay, so that actually, you talk a lot about the skill sets, which of course, given the announcements that we just had from the government yesterday, is absolutely top of mind on everyone to connect up the needs of the future with the realities of the skills on the ground, the capabilities. So that's going to bring me with my other question here. What capabilities do healthcare professionals need for the future of AI and data in the NHS? Who would like to?
Well, Indra is probably best placed as a healthcare professional, but why don't you start, Indra, and I can chip in if.
Yes, so I think this is this goes back to my fundamental point of it has to be also a bottom-up approach. We've seen some really good things come out of HEE, Health Education England, after the Topol review, and I hear Eric is giving a closing note later today. But also it's about training those people who aren't necessarily healthcare professionals. So we have a wonderful cohort of analysts in the NHS who we should never underestimate how much they do. And when we talk about data and AI, one of the things we work very closely with our colleagues in NHS England is about how do we help upskill some of these analysts as well. And in the wider team that Simon, I'm going to big you up here, that Simon oversees, we have also an analytics team who are working very closely with the profession to say, how do we bring those professions with us in this space? It's also about learning new techniques. We talked about industry. We can learn new techniques, new data science techniques, about analysing data in that space as well. And also about, in the Topple review, there was a chapter on AI and robotics, and a lot of it is around statistics. And those of you who are AI experts know that it is essentially a whizzier form, I say this in the lightest possible sense, of statistics. And how do we train a new cohort of healthcare professionals? And we have a training program called the NHS Digital Academy, of which they do have a sector in there on both AI, statistics and data science. So there's a lot of work happening across the space. And what we try to do in NHSX and with the AI Lab is to try and bring some of those together as both resources, but also as partnerships that we're working with. And Simon, I don't know if you've got more comments on the more analytical side as well that you've been working on.
Well, I would just say that I think it's really important that we upskill our analytical community in the NHS, and there's a lot of work going on between NHS England and NHSX to do that and to build a real sense of an analytical profession. And I think that also means that we have to form the right partnerships with academia, work closely with universities and researchers, so that we not only so that we can bring in the right talent, but also so that we can have access to their thinking as part of our normal day-to-day operation. More broadly, I think in terms of the healthcare profession, I think that it's really important for us to give them the confidence to be able to embrace digitization of the health service through either skills enhancement and training, but also sometimes just the confidence to be able to use these tools and to make judgments, particularly around data and how to share data. And so that's why the work that we're doing to simplify information governance guidance is so important, and to target that at the front line. So we want to sweep away what I usually call as jet washing away the treacle, and make sure that your nurse, your doctor and other practitioners on the front line are able to look at a situation and feel that they can act in a certain way, share data in order to improve patient care and save lives. And that is one of our key aims in not only the strategy, but our broader work across NHSX.
Absolutely. I think we've got 1 or 2 minutes left. It seems to me, just from how we're, where we've reached the conversational flow. I mean, I think this wider piece around digital information health literacy is an absolutely humongous one. I mean, not just for the workforce, but indeed for the general public. And it goes to the heart of also the trust thing as well. And of course, we've seen through COVID, as things move online, we're almost at risk of even greater digital divide if we don't address that quite sharply. I know Health Education England are doing quite a massive digital health and information literacy initiative, for example. So just to close, I think there's a couple more questions, but on the point of, yes, clinician workload efficiency, including intelligent patient appointment scheduling. Is this a priority?
So just on that note, we've had a company as part of the AI award look into appointment scheduling, and I mean, the priorities are outlined in the long-term plan. So without kind of reiterating those, I would say, yes, we do have priority. Outpatients is a priority within that. And workload efficiency is important. It is certainly important. And we do also have a number of case studies coming through the award, which are looking at, I've explained them previously in other sessions, but looking at, for example, when a patient is well enough to leave the ITU, quite often, understanding that process and improving the flow through wards can be really helpful. So, yes, we've got a huge number of work streams looking at these areas.
Fantastic. And one final question, before I'm sure we'll get asked to finish, is relates to the health and social care data strategy. Where will secondary use of data fit in this, interoperability and standards? What's your approach to strategy on this?
Well, interoperability and standards remains obviously key to our whole approach. Secondary uses and direct care, they will all be covered. Timely and ethical use of data for research and planning and commissioning of services, absolutely essential. And I think that one of the things that we have learned through the COVID experience so far is that the COPI framework that we've put in place, which are regulations to allow for enhanced sharing of data, they offer us some opportunities to be able to work more efficiently and effectively. And so I think that we may want to look, this is quite speculative, but we may want to look at how we define some of these things. So what does direct care mean? What are secondary uses? And can we take a more sort of mature and forward-looking approach to some of those definitions?
Fantastic. Really, really excellent. I think that is the end of the session. I think Tabitha is going to be coming shortly on screen to tell us to exit. But I guess just a final sort of comment or observation, I guess, until Tabitha comes on, is Indra, the community practice. Do you see this almost like a hotline to the top, from the community to kind of, sort of share experiences, the whole kind of, the nitty gritty of actually making this work on the ground and, ideas, suggestions, to make the way up at a policy level? How do you see that?
I see this as a real hands-on. We've got some wonderful people, but this is a real hands-on. Show us what you've done, show us how you've done it, show us how we can all do better. So this is all about getting your hands in, sharing what you've done, and building a real ecosystem in this space.
Fabulous.
Gosh, thank you so much. I really feel like I got a under the hood look into what's happening at NHSX. So that was incredibly appreciated. Tina, Simon, Indra, thank you very much. We'll see you again soon.
Thank you.
Thank you. Bye-bye.
And everybody else, we will see you at 12 o'clock. Thank you very much. Bye-bye.
Want access to more CogX videos? Subscribe now for free at cogx.co.